transsexual clients. Transgender health care is literally not taught. So let me ask you that question. How many of you learned about transgender people as part of your educational background, social work, psychology? I'm looking at 2 or 3 or 4 people. And how many of you who did learn this in school have been in school in the last 5 years? Okay, because that would be my assumption, is that it's slowly starting to come in. Many physicians don't ask about same-sex relationships and make assumptions. I just did a panel with a colleague of mine she is a cross-dresser, and one of the things she said, I don't know if I agree with this, but I just thought it was funny anyway. She said to the doctors in the room, we did it for physicians, she said, if you have a male client who comes in with shaved legs, it's a good chance that he's not a runner. But, you know, it was a great line, right? I mean, are you asking? Are you using that as any kind of way to ask people? Because, again, if the assumption is every time you see Bob Smith, and you know Bob Smith is married, and you're assuming that Bob Smith is in a closed, heterosexual, monogamous relationship, you're not asking Bob Smith about safe sex, and you're not asking him about his sexual practices. And we know, and I'm just going to tell you this, you're just going to have to take my word for this, there is an entire underground culture of heterosexual men who have lots and lots of gay sex. You know, I mean, we have this new term, you know, being on the down low, like way before that term it was happening. You know, there's book houses that, you know, bookstores that, you know, pornographic bookstores that people go to and have sexual activity, and I was seeing that, you know, 25 years ago, and I still see it today. So that has not changed at all. But, you know, these men are often bringing home diseases. So whatever your moral values are, whatever your philosophical thoughts are about why they're doing this, whatever it is, there's a medical issue here that we need to be treating very seriously. LGBT people are rarely able to have their families covered under their health insurance. Now in New York, through my state university, we can, and we do, and I do. And I literally say a little prayer every time that I pay my little copay for my 2 kids and my partner that are all covered under my health insurance. LGBT youth are often silenced. They're told they're too young to know if they're gay. LGBT people choosing parenthood need assistance about how to do that. And again, I could stop right here and spend 2 hours just talking donor insemination, and surrogacy, and adoption, and domestic adoption, and international adoption, and foster care, and how do we do this, and how do people have children. But people come in and ask questions, or people don't ask questions and they need information. It's a little better now with the internet than it used to be. But this is a true story. Albany, New York, middle of the 1990s. Call up the OBGYN to say, you know, you know, can you help me with donor insemination? I'm a lesbian. Click. Click. I mean, it's a prank call. We can't take that seriously. You know, we don't do that. You know, the gratitude that I felt towards the doctor that said, sure, why not? I mean, this is crazy that I get whelmed up with crying because the guy says, sure, why not? And that's what he does for a living? I mean, that's nuts. Actually, I have a funny story. I want to hear a really good story? Great story. Albany Medical Center. So I go in for a fertility thing. So, you know, this poor guy, I mean, this poor guy. So as a resident, okay, this is obviously his, like, first, he's got this big chart in front of him, and he's going to ask me these 2 hours worth of questions, and we go through the whole thing. And of course, does it say on there anywhere, are you a lesbian? Does it say anywhere, do you have sex with men? Never says that. But, you know, how often do you have sex? So I answered, you know, that I went through the whole thing, right? You know, clearly I'm having pretty serious infertility problems, right? So he closes the book, really sweet guy, closes the book and looks at me and says, you know, we're really happy to work with you, and da-da-da-da, and we're going to do this. Do you have any questions? And I said, well, I just thought you might want to know that I'm a lesbian and I haven't had sex with a man in about 20 years. And he kind of freezes. He opens the book back up and says, okay, let's start again. It's very sweet. But I assure you, he will never make that mistake again. He will never make that mistake again. But is this what's taught to medical doctors in terms of how they're doing their work? Okay, so what I want to do is I want to talk some about some of the issues that LGBTQ people bring into therapy. I don't have gender on this list because I'm going to talk about it all day tomorrow. Okay, that's the only reason it's not on the list. Usually it's on my list. So coming out, marriage, parenting, divorce, mental health, addictions, youth, and aging. And as I said, I could spend between 2 and 3 hours on any one of these topics that I'm going to be spending a slide or two on.